Anne, and I'm here today to teach Ryan about the differences between true and false labor. Ryan's wife and my sister is currently 35 weeks pregnant, and recently she's been exhibiting some premonitory signs of labor, such as increased back pain and uncomfortable breast and hips. So as this is their first baby, Ryan is extremely anxious that they will not know how to determine whether it's the real thing or whether this is the practice run. So first we'll discuss contractions. Contractions occur when the uterus muscles tighten and relax. Some women describe the feeling as being strong menstrual cramps, and others describe it as intense back or pelvic pain. In true labor, these contractions help the baby descend through the birth canal. In true labor, these contractions are regular, they come at certain intervals and increase with frequency and intensity over time. The pain starts in the back and it moves to the pelvis, and these contractions are not relieved by changing position. So if you go for a walk or you try to take a bath, it's not going to change them. Because these contractions are helping the mom's cervix to dilate in the face. So contractions in false labor are irregular. They don't get closer, and they may stop for about an hour. They might stop like after an hour or so. These contractions are usually felt in the abdomen, and walking and changing positions may actually lessen the discomfort. So a false labor is extremely common, and sometimes you don't know the difference between the two. And the only way to be able to figure out which one it is to have a vaginal exam. And in the end, if there's no changes, then you're in false labor. So there's two signs that are red flags that indicate that you'll probably be visiting the hospital pretty soon. The first is a bloody show, which is a pink, slightly bloody discharge from the vagina. The second is the rupture of membranes. And the rupture of membranes can come as a trickle, a gush of amniotic fluid from the vagina. And both of these signs can happen either before or during labor. So I have made a poster, and I have figured out that there are 4 questions that you got to remember, Ryan. So when you guys are running around trying to figure out whether this is true or false labor, just remember these 4 questions. The first one is, how regular are the contractions? So do they occur at regular intervals that grow shorter over time? So for example, every 10 minutes, every 8 minutes, and then they go to 5 minutes? Or do they occur sporadically and without a predictable pattern? The second question is, where do you feel the contractions? So does the pain start in the back and then move to the abdomen? Or does it start in the, does it typically stay in the abdomen and the groin? The third question is, do the contractions change when you switch your position? So for the real thing, they keep a steady pace, whether you sit, stand, bathe, walk, whatever, they don't change. For false labor, they may slow or stop when you rest or you shift position. And then the last question to remember is, how long does each one take? So contractions that last 15 to 30 seconds on the onset and get progressively longer are true labor. Now, contractions that vary in length and intensity, that don't really have a predictable pattern, false labor. All right, Ryan, I am going to put you to the test now. So I have made up a game, and I have developed a couple cards with different symptoms on them. So I'm going to have Ryan decide whether these symptoms are true labor or false labor. So if you can just take those cards and figure out which one. I can help you. I'm here to help.
All right, let's see if I get these right. Contractions that stop, that's definitely going to be a false labor.
Good job, good job.
Yeah, the easy one first. All right. Increase in duration, I'm going to say true.
They definitely increase in duration.
Regular intervals, I'd say true.
Yep.
Exams show the cervix is dilating. I'd say it's
I
true.
would say that's a pretty good sign.
Yeah. Contractions that felt in the abdomen. That's the wrong spot to start.
Yep, that's right. So usually they start in your lower back and radiate around to your abdomen.
So they don't start there first. Back pain starts in the back and moves to the abdomen.
Ah,
So
there you go. There you go.
So-
You're cheating now.
Increase in intensity. I'm going to say that's true.
Yep, they definitely get stronger over time.
Contractions not relieved by position change or bathing. Since they don't stop, I'm going to
Yep,
go
there's
that's true.
no way to stop those contractions.
If they're regular, that would be false, right?
Yes.
Yeah? Okay. If they're regular, that would be true, wouldn't it?
That would definitely be true. I mix these up well.
If they increase in frequency, from everything I know, that has to be true.
Definitely. They definitely increase in frequency over time.
And if walking and position changes lessen the discomfort, that would be false, right?
That is false. Yep. If you know that, like, if Catherine, not you, is walking around and they sort of lose their intensity, then they're probably false labor. Again, the best way to determine whether it's true or false labor is to have a vaginal exam. So anyways, Ryan, do you have any questions for me?
Well, while waiting for Catherine to determine whether it's a false or a true labor, what should I be doing?
Oh, that's a really good question. Okay. So I would tell Catherine she needs to take a nap or, lie down, rest on her left side, as this promotes really good oxygenation for the baby. I would also grab a watch and start timing. So, for example, if your watch says 12 o'clock
Yes.
and she has a contraction and the next one's at 12:05, you know that they're 5 minutes apart.
Okay.
Third thing that I would definitely do is call the doctor. He'll ask you all sorts of questions about the contractions. So, and then he'll tell you whether you need to come in or not.
Okay.
All right. So how are you feeling?
I'm feeling a little bit more confident. Thank you. And I'm looking forward to the arrival of the new guy. Thanks,
I
Anne.
think you are ready. No more questions?
No more questions.
Excellent. All right.